My name is Monika Stickler and I'm with the Red Cross for more than 30 years as a volunteer, as paramedic and crisis intervention team member. Since 2006 I'm an employee at the Red Cross headquarters in Vienna. My position is head of emergency medical services and psychosocial support, and I'm deputy commander in charge. The Austrian Red Cross is a non-profit organization and implements humanitarian activities with the help of over 72,000 volunteers and around 8,600 employees, and this for more than 140 years now. Through its activities, the Austrian Red Cross is supporting the most vulnerable people in society and is working at national and international level. We are providing a variety of services to the public, including emergency medical services, ambulance services, first responder, disaster relief, psychosocial support, and many, many more. So our organization does really work with a variety of people and therefore addresses various problems. Since the beginning of the COVID-19 pandemic, I'm working for coordination and communication between the authorities on state level and the organizations which are involved to COVID-19 response and all our Red Cross branches. Since the very beginning of the pandemic, the Austrian Red Cross played a major role in the nationwide COVID-19 response, and without a short amount of time we had to adapt our daily operations and services and started supporting the national government in their efforts to manage this crisis. For example, the Austrian Red Cross contributed with its expertise to the National Crisis and Disaster Management Board, helped to establish new decision-making structures in the Ministry of Health, and created and produced a public information campaign. As responsible for MHPSS, mental health and psychosocial support, I work together with other PSS professionals and organizations on national and international level to support vulnerable groups with specific informations and support. We built up a network of support also for staff and volunteers. All our activities were continuously attended by evaluation and studies. The Austrian Red Cross was heavily involved in national testing strategy and collected samples through mobile teams, drive-in stations or testing centers. And that all over Austria. Of course, all the regular nationwide services had to continue just as before, but now under strict safety measures, and our employees and volunteers had to wear PPE. Now it is business as usual, more or less. It's still very hard to assess the long-term impacts, consequences to the emergency has left on the daily operations, since the pandemic is not over yet and we keep supporting authorities with various tasks. These past 2 years of managing the pandemic were, of course, challenging, and at the various stages of the pandemic, our staff was also affected. Even though the duration and the size of the pandemic made daily operations difficult, and we can also see some positive consequences. For example, a very positive effect is that cooperation between our organization and other stakeholders strengthens a lot. This was very helpful for the implementation and coordination within the pandemic response, and hopefully will be beneficial for future emergencies. The past 2 years have also shown that many activities, such as trainings or conferences, can easily be conducted remote, and which will in some cases remain so into the future. What we all have learned from this pandemic is that it is not only an issue of health. This crisis had massive impact on multiple areas in relation to well-being, which all need to be taken into consideration. One of my personal lessons learned is that it is necessary to be careful with myself too, to have enough resources to help the others.
Hello, my name is Paloma Miravet and I am an emergency nurse at Samur Protección Civil of Madrid in Spain. Samur Protección Civil is a public emergency medical service created in 1991 and dependent on the City Council of Madrid. We take care being Madrid the capital city of Spain, we take care of about 5 million people population, counting inhabitants and floating population. Samur, as a public institution, has 6 main duties and responsibility. The first one, and more important, is to cover the first medical response in emergency situations in Madrid metropolitan area, usually in the streets and public areas of the city, for example, shopping centers, government buildings, and the subway or whatever public transportation, and so on. We also, in collaboration with social services, we provide assistance to homeless and mistreated women, and also we try to detect the child abuse and abuse in the elderly. It's very important for us to detect the needs and put them in knowledge of police or social services and make a follow-up as needed. We deal with the coordination and medical attention of mass casualty incidents and situation of public calamity and disaster. We provide medical coverage during scheduled events as foreseeable risk, football matches, and so on. We also take care of the management and organization of the voluntary response and the education and training of them and of the first responders, security professionals, officers, police, and so on. During the COVID, we had to change many aspects of our regular work, like working in a temporal hospital made in a convention center. We used three big halls from up to almost 750 beds in each hall. And we did have beds, regular beds and ICU beds. And we did have the night shift assistants, the staff management, the triage and admission, admission management also, and the transfer by bus from other hospitals that were really crowded to hospitals to IFEMA. We also did the COVID test to all the workers suspected to be infected, and PCR test to all city council workers, fire brigade, police, and also summer. And very important, the supervision of the nursing homes for elders, because it was a very difficult place. Our first wave was the worst in terms of dead and critically ill, but the sixth wave we haven't finished yet. At the beginning produced a human resources problem because it was so contagious that the Omicron variant was so contagious that many people couldn't go to work, and we did have a problem not only in Samur but in every workplace. The most disadvantaged people, I think, they were the elderly, especially those who were living alone or in nursing homes, and they weren't able to cope with the effects of COVID-19. The combination of lack of personal and resources and the forced isolation of residents led to a deterioration of residents, not only physically but also emotionally. Another disadvantaged group was people suffering from chronic diseases, such as high blood pressure, diabetes, heart disease. And this, if we join it with the weakness of the public health system in that moment, due to COVID-19, led to a perfect storm of lethality in the first wave. It's too early to talk about long-term negative effects on the people, But however, a study we carried out on emergency healthcare in Samur personnel and the short-term effects produced by the pandemic disease shows that the most frequent problems were sleep disorders, fear of infecting family or relatives, and impotence for not being able to provide a more extensive medical care and properly respond to all the health needs of the affected population. One of the most lessons learned is to deal with a shift in procedures to make a disaster medicine philosophy and the flexibility of the personnel and willingness to assume new roles. The support of the nursing homes, the change in our way of working, the contamination devices, PPEs, and so on has been really a challenge for us, and we have a good lessons learned. I hope this helped, and have a nice day wherever you hear this video. Bye.